The trial of Lindsay Clancy has captured the nation's attention. This young mother on trial accused of murdering her 3 children.
Was life support ended for Callan Clancy on January 27th, 2023. Family was given an opportunity to see him, and then life support was ended, and then his heart stopped.
You knew where she came from, South Shore Hospital, right?
Yes.
And you knew that there had been discussion about postpartum psychosis. Isn't that right?
Yes.
It's a case that has divided the public. Did Lindsay plot and plan the killings while manipulating her husband? Or was she the victim of mental illness and over-medication? Each witness, each day of testimony painting an emotional picture of a family in crisis. But the ultimate question, what was causing all of this? Lindsay Clancy or the illness? The killing of 3 young children, it's filled with emotion, and there is so many things that go through your mind when you think about what happened to these children.
I'm going to draw your attention to a particular patient that you had some interaction with in January of 2023, and that was Lindsay Clancy. Do you recall treating her?
Yes.
And was she in that trauma surgical intensive care unit?
Yes.
Do you remember the first time you interacted with her?
Yes. I got her.
And would that have been on the first night she was there on January 24th?
Yes.
How did she come to your unit at the Brigham?
She came from the emergency room, went to MRI, then came to the ICU to me.
And were you aware that she had been seen at a local hospital?
Yes.
In Weymouth, the South Shore Hospital?
South Shore.
While you were treating her on that first night, were you the main nurse assigned to her care?
Yes.
And what were your responsibilities as the nurse assigned to her care on that first night?
First night, she was intubated, came to me intubated. We had to maintain her blood pressure at a certain number, just care, regular nursing care.
Okay, and were you aware that she was on what's called a 1-to-1?
Yes.
What does that mean?
That means patient usually can't be left alone, and also depending, you always have to have somebody outside the room with sort of monitor the patient.
And is that because that patient has been identified as a potential suicide risk?
Yes.
Okay. Now, on that, the 24th into the early morning hours of the 25th, was there a particular event that you were witness to for this particular patient?
She coded.
What does that mean?
Means her blood pressure dropped for her. It meant her blood pressure dropped and it wasn't sustainable with life.
So what did you do when her blood pressure fell and she coded?
We started CPR, we did compressions.
And this event occurred approximately at 3:30 in the morning, correct?
Yes.
Was she eventually stabilized after that code?
She was.
And did they do something as far as intervention to try to maintain her blood pressure?
We increased her pressors. We added 2 more pressors. She was already on 2. They placed chest tubes in, started what we call a massive blood transfusion protocol.
And did this all occur in the trauma surgical intensive care unit, or did she have to be taken to a different unit?
No, it all occurred in her room.
And other than medical staff that was treating her that particular night, did you observe anybody else present?
She had 2 police officers outside the room.
Okay, and so did they remain outside the room for the duration?
Always outside the room, yes.
As far as your interaction with the patient on that particular night shift, was she responsive at all during the time that you saw her?
No.
And with intubation, you mentioned she was intubated. Is a patient often sedated in order to maintain intubation?
Yes.
Why is that?
Helps them not fight the vent, breathe better, and make sure that they're comfortable.
And what does sedation do to an individual?
You're calmer, you're sleeping,
Makes them more relaxed.
relaxed, yeah.
Other than that night, that first night, the 24th into the 25th, did you have the occasion to treat this patient at other points within that week?
Yes, I have.
And I'm going to draw your attention to January 26th of 2023. Do you recall interacting with her on that day?
Yes,
And is it fair to say that on the 26th she was still intubated
she was.
and under sedation?
Yes,
Well, during this time period on the 26th, was she arousable, meaning could you initiate some communication with her?
some, yes.
And were you able to kind of give her commands in order to care for her that she was able to follow?
Yes.
And when I say able to follow, obviously,
Simple, yeah, commands.
what kinds of
Like, can you
commands?
squeeze my hand? Can you wiggle your toes? Just basic neuro check to just make sure she's alert and she's able to follow, understand what you're saying to her.
And for this particular patient, you're aware that she presented with a spinal injury, correct?
Correct.
And so movement of the lower extremities was not something that she did.
Correct.
But did you observe her to move her head around and move her arms around?
Yes.
Now, you also had the occasion to treat her in the overnight shift of January 28th of 2023, correct?
Yes.
And during that time, she was also still intubated?
I believe so. I'm not sure. I've had her both intubated and
Okay.
extubated.
While she was still intubated, did you have a system that you could use to communicate with her?
Yes, board. We have a whiteboard or clearboard that sometimes patients can write on.
Did you observe her to utilize that whiteboard to write on it?
Yes.
And at this point, when she's writing on the board, her eyes are open and she's responsive.
Yes.
And she's able to tell you how she's feeling, correct?
Yes.
And fair to say she used that whiteboard to tell you she was confused and that she couldn't feel her lower extremities.
Yes.
And do you recall her complaining of having pain?
I don't recall.
During this time period on the 28th, do you recall whether the patient was placed into restraints?
Yes.
And why was that?
Well, we restrain all patients that are intubated for safety,
And why?
so they don't pull out the tube or pull out any lines that they have.
Okay, and so as they're not at that level of sedation anymore where they're just completely asleep, there is danger that they could move and cause damage to
Medical equipment out of the way.
Okay. And so in this case, as far as the restraints go, fair to say that they were soft restraints.
Soft, yeah.
And what does that look like for a patient?
Meaning
Well, like what does a soft restraint look like?
a soft restraint, it's like maybe I would say a cushion restraint, and then it's tied to the sides of the bed. So it's all the way around your wrist.
Okay. At some point by the end of that shift, you recall that she was extubated.
Yes.
Can you tell us what extubation is?
That means you remove the tube. You usually stop all sedation.
And were you able to make observations of the patient once she was extubated?
Yes.
Did her presentation change at all from your previous interactions with her?
No.
Did you have the occasion to treat her again on January 30th?
Yes.
And again, at that point, she has already been extubated. And are you able to then make an assessment of her without the tube in about her orientation and her alertness?
Yes.
Is that something that you kind of do each and every shift?
Every shift, yeah.
Was she still on sedation medication at that time?
No.
And what was your observations of the patient's demeanor now that she's extubated?
She's flat. No emotion either way.
And is that fairly consistent with what your observations were of her during the course of your time treating her?
Yes.
How about being alert and oriented? Did you observe her to be alert and oriented?
She was.
And did you observe her to identify sleep as an ongoing issue?
Yes.
And so as part of the plan for treating her, did you address the sleep?
Yes.
And how did you guys address sleep?
The plan was to start the first sleeping medication for her. I don't remember exactly which one, and then wait a couple hours, see if it worked, and if not, try another medication.
Okay, and this actually occurred over the course of a few days,
Few
correct?
days. Yeah.
During the time when you observed her to be flat, as far as her affect goes, did you also observe her to be cooperative,
Yes.
meaning she followed your directions?
Yes.
Did you treat her, or were you the overnight nurse for her on February 2nd? You recall?
Yes.
On this particular night, February 2nd, do you remember her making a particular request of you or ask you for something specific?
I think that was the night she wanted to reach out to her lawyer.
And did you note that in your nursing notes?
Yes.
Why did you note that particular request?
Objection.
Can I see counsel?
On this particular night, the 2nd, she made a request of you for her lawyer, correct?
Yes.
Was that something she had asked you before?
No.
And so did you think it was something worth noting?
Yes.
Why would you note something like that?
Because that was the first time she referred to anything going on with the case or whatever.
Okay, and so you had the occasion after she was extubated to have some casual conversation with her, correct?
Yes.
And this was not a conversation you'd had before?
No.
What did you do when she made that request? What was your response?
I sent what we call a consult to the social worker in order to coordinate reaching out.
On the 24th of January, is that correct?
Yes.
And do you have a memory as to approximately what time was it in the evening?
Well, she got to the ICU, it was around 3.
Okay. You're very soft-spoken.
Sorry.
If you can just keep your voice up so all the jurors can hear you.
She got to the ICU around 3 a.m.
Thank you. And she came by med flight?
She came to me from MRI.
And MRI obviously would be when you're taking the pictures.
Picture,
And that would be on the 24th of January in the early morning hours, correct?
I think it went into the 25th.
Into the 25th?
I think so.
Counsel asked you about the whiteboard that she would write on. And I think it was, again, if I'm wrong, correct me, was it January 28th that she used for the first time the whiteboard to communicate?
Yes.
And the whiteboard basically is just a whiteboard, and,
Yeah.
and you write on it. Is that correct?
Erasable.
And she was not able to speak because she was intubated, right?
Yes.
And she was in the restraints that you've described as well, right?
Right.
Moving forward, January 28, 29, 30, into February 1st, February 2nd. It was on February 2nd that counsel asked you about her asking to reach out to her lawyer, correct?
Yes.
And do you know who her lawyer was at that time?
No.
Had you seen him before?
No.
Did you know, is his name Attorney Gelb?
No.
Make any reference to you?
No.
Do you know that whether or not she had conversation with Attorney Gelb regarding her status as being under arrest by the numerous police that were guarding the room?
I don't.
Do you know whether or not she was ever able to talk to Attorney Gelb, or did you refer her to the social worker people?
I put in a consult for the social worker.
Do you recall reviewing the documentation as to what's captioned present illness in the records? Did you know that she was presenting as a transfer from Social Hospital?
Yes.
Did you know that that under present illness, and the history would be that she's a 32-year-old female with history significant for postpartum depression? Did you know that?
Yes.
And did you know that after the fall with the C1 burst fracture and the complex transection of T5 and T6, she also had rib fracture, correct?
Yes.
on page 66, that would make reference to the time frame going into the 25th, on the 25th, that she was reacting to painful stimuli, right?
Yes.
And that basically means that she's not conscious, if you will, but she's able to react to,
If you cause pain.
yeah, okay. There's a notation of a contusion, laceration, and crushing of the thyroid with thyroidal edema. What does that mean?
She has swelling, I'm assuming, around her thyroid.
Okay, and that is,
Again, this is not my scope
okay,
of practice, so.
okay. On page 70, the same evening, making reference to the fact that in addition to the injuries to the spine, that she also had the rib fractures and was currently in shock. Do you remember that she was in shock? Yes, no?
Yes.
Okay. Would you agree, or do you recall that there's a notation that this patient is critically ill, and noting that she has postpartum psychosis on page 72?
I see counsel.
When you're treating a patient, one of the things you try to do is to know what their total body and emotional condition is, what they've been dealing with, and what injuries they have, right?
We get a rundown or history of the patient.
Sure. And as it goes into the end of January, and she had been communicating on the whiteboard, you were aware at that point why she was in the hospital, right?
Yes.
You knew where she came from, South Shore Hospital, right?
Yes.
And you knew that there had been discussion about postpartum psychosis. Isn't that right?
Yes.
On January 26th, she was still intubated. Is that right?
Yes.
And she was under sedation, right?
Yes.
And then you referenced January 28th overnight shift. She was still intubated, right?
Yes.
And January 28th is when she first started utilizing the whiteboard. Is that correct?
Yes.
But she was intubated, yes?
Yes.
She was restrained to the bed,
Yes.
and had the tube was still in her mouth, and she was writing on a whiteboard on the 28th of January, correct?
She was able to, yes.
January 30th, she was extubated, as the district attorney asked you, right?
Yes.
So at that point, was she able to talk, talk?
Talk.
Okay. And then on February 2nd is when she used she asked about wanting to reach out to her attorney. Is that correct?
Yes.
But you had no knowledge as to her mother and father getting an attorney for her while she was in custody with the police all around her?
No.
Okay. And you tried to help her out as best you could?
Yeah, to coordinate. It's harder at night to,
Sure.
so I wanted to pass it on.
And finally, she was not able to have visitors per order of the police. Is that correct?
Clancy kill her 3 children. Was it this irresistible impulse? She couldn't control herself?
Now, I want to direct your attention to January of 2023. Did you interact with a patient named Lindsay Clancy?
I did.
And was that on January 29th, 2023?
Yes, that was the first of a handful of times that I saw her.
And why did you meet with Lindsay Clancy on January 29th, 2023?
Yeah, so my team was seeing Ms. Clancy for a number of reasons, including for psychiatric safety risk assessment. She had come in reporting a suicide attempt, which is a common reason why my team would be called, is to continue to ensure that patients are safe when they're in the hospital. So we make recommendations about kind of safety status, what can we do to help keep a patient safe, but then we also make recommendations related to medications. So that's why my team was following her. So that was one of the reasons why I saw her on the 29th, is to continue that assessment. I was also called to ask I was asked a new question that day, a consult question on whether she was able to make the decision to change her healthcare proxy from her, at the time, husband to her parents.
When you evaluated Lindsay Clancy, was she able to voice a choice to you about who she wanted to be her healthcare proxy?
Yes,
And is she speaking to you or writing this down?
she's speaking.
Speaking. So she's already been extubated at that point.
That's correct.
And she's speaking to you, and were you aware that Patrick Clancy was her healthcare proxy?
I was told that by her primary medical team.
Okay. And when you talked to Ms. Clancy, did she tell you who she wanted to take over that role?
She did.
And who was that?
Both her parents.
And you talked about that needing to be a consistent choice. How did you ensure that was a consistent choice with her?
Yeah, so we waited to make the change from Patrick Clancy to her parents until the next day for a variety of reasons. We wanted to ensure that that choice was consistent over time, and especially because the day that I saw her, she had just gone through some pretty major medical events, including she had a major spine surgery, a decompression and a fusion. She had gone through some oxygen desaturation overnight, so was not breathing as well. Her heart rate was up, all of which then led to her being what we call delirious. She was confused overnight to the point where she asked her nurse, "Am I delirious?" And she was also experiencing some visual hallucinations. So that was one of the reasons why I was called in, to make sure that she was able to make that decision to change her healthcare proxy. And then in addition, the team had also voiced, concerns that she had come in after a reported suicide attempt. And so making sure that she was able to make that decision of sound mind. And so we actually waited until the next day when she could be reassessed. At that point, her delirium had cleared, and she was continuing to make that consistent choice to change her healthcare proxy to her parents.
And in fact, you noted in the medical records that the hallucinations were part of an issue with oxygen.
It could be. That could be one of the reasons. Delirium is usually due to a variety of different medical reasons, and oxygen desaturation could be one of them. She had also just recently had anesthesia related to a surgery that she had on her spine, so that could be another reason. And then her heart rate was also actually quite elevated, so that could be another reason.
Is it common for patients who are just coming off of anesthesia from surgery, who have an issue with oxygen and other medical issues that you described, to have visual hallucinations?
They can. It's not that everybody does, but they can. And delirium can be quite common after surgery, and particularly anesthesia.
And those hallucinations that she was having, those were resolved by the next day. They were over by the next day, correct?
That's correct.
And her choice to change her healthcare proxy to her parents was consistent the following day, correct?
That's right.
You also talked about the patient has to understand the risks and benefits of the decision, correct?
That's correct.
How do you make sure the patient understands that?
Yeah, so one of the things we do is really ask patients to take us through their thought process of why they're making that decision and what led to them making that decision at that moment in time. So we're able to kind of see their thought process and ensure that they're understanding, what it means to remove one person and add another.
And what was Ms. Clancy's thought process in explaining that to you?
Yeah, she was saying that her parents are quite supportive to her, and that she was thinking that she would have to change her healthcare proxy from her husband to somebody else. And we didn't necessarily go into the reasons as to, why she would have to change it, but she explained that she was very close with her parents. They would see each other frequently, given that they lived in close geographic proximity, and that she felt that they were very supportive to her and would have her best interests in mind should we need to invoke the healthcare proxy, or that if she couldn't make her own medical decisions.
So was there a concern on her part that her husband wouldn't have her best interests in mind at that point in time?
Sustained.
And during this conversation with the defendant going over all these points, did you ever have difficulty understanding her?
I did not.
Did she ever appear to have difficulty understanding you?
So the first day when I saw her on January 29th, she described herself as feeling confused, and I definitely witnessed that as well. We went through a bedside cognitive evaluation, and she definitely made some mistakes on some of the cognitive evaluation. Therefore, I did diagnose her at that time with delirium.
And then she was reevaluated the following day, and there were no issues with her understanding, and the delirium was gone, correct?
That's correct.
And were you aware during this evaluation that Ms. Clancy did not have a brain injury?
I'm sorry, can you repeat the question?
Were you aware that Ms. Clancy did not have a brain injury at that time?
One of the things that we look at is any kind of relevant medical information that might be available to us. And I noticed that her Glasgow coma scale, when she was transferred to Brigham and Women's Hospital, was a 10, which would indicate that she could potentially have had a moderate brain injury. But I don't recall thinking about whether, specifically whether she had a brain injury.
Were you aware that a CAT scan was done, page 110 of the records, and on the CAT scan, the impression was no acute intracranial findings, so no brain injury.
So you can.
CAT scan, correct?
I did review the head imaging that was available at the time. You can have a normal CAT scan and still have a brain injury.
Were you aware that she had multiple CAT scans that showed no bleeding in the brain, no skull fractures, no injuries, just visible injuries whatsoever?
I'm sorry, but can you repeat the question?
Were you aware that she had multiple CAT scans at South Shore Hospital and at Brigham and Women's that showed no skull fractures, no intracranial bleeding, no hemorrhaging, no visible damage whatsoever?
Yes.
And were you aware that she was evaluated at South Shore Hospital and at the Brigham, and she had no external injuries on her head either?
Yes.
Now, she was allowed to change her healthcare proxy to her parents, correct?
That's correct.
But this case is different. There is an absolute documented history for Lindsay Clancy. So the defense is coming to the table with a lot of credibility.
So finally, Dr. McDonough, did this defendant receive surgery at South Shore Hospital?
Not that I'm aware.
Did you observe any cuts, abrasions, or blood on the area of her head?
No.
And based on your review of those findings on the CT scans, was there any noted injury from the head CTs that you could tell?
No.
And were you able, after using that bear hugger device, able to get her her core body temperature back up to normal?
I don't recall.
Did you ever observe those wounds that you observed on her neck or her wrists ever start bleeding actively again?
No.
I have nothing further.
Just ready to.
Morning.
Morning.
So would you agree with me that when Lindsay was brought into the South Shore Hospital that she was unconscious?
I recall her eyes being open, but she was nonverbal.
Okay. So as an experienced emergency room doctor, can you tell me when someone's unconscious, what is that? What are the symptomology of it? What does that mean?
Usually means they're completely unresponsive with eyes closed.
Okay. Was she responsive?
Not verbally.
Was she responsive at all?
She was responsive to pain.
So that means that you would do something to cause pain, perhaps the bottom of the foot or whatever it is, to see if they have a reaction?
Correct.
And would you agree with me that when people even have very, very serious brain injuries, that they can respond to pain stimuli?
Sometimes.
Sometimes. So her eyes were open. Were her pupils equal and reactive to light?
I don't recall.
You don't recall. What does it mean with PERL, pupils equal reactive to light? What does that mean?
Exactly what you just said. It means her pupils are equal and reactive to light.
And as a doctor, what does that tell you?
It tells me that there's no significant neurologic injury.
And in this case, you don't recall if her pupils were equal or reactive to light?
I don't.
Okay. And that's when you take the little flashlight sometimes and you put it over the eye and see if there's constriction of the pupil.
Correct.
Did you do additional evaluations of her to see what her neurological function was?
She was pretty quickly intubated from what I recall, so after that it would be difficult to assess her neurologically.
Sure. Was she on any pain medication, if you remember?
I don't remember.
You recall, did she have difficulty being intubated? I mean, would you agree with me that if you're not under some type of medication or sedation or unconscious, it hurts to be intubated, doesn't it?
We wouldn't intubate somebody without first giving them some induction medicines.
Okay. So what would the induction medicines be?
They're not universal.
Well,
That would depend on the
What are the
case.
induction medicines that you used on Lindsay Clancy?
I don't know. I'd have to refer to my record, and also I wasn't the one who did the intubation.
So she was intubated, had the tube coming out of her mouth, she's laying on the table, and you are continuing an assessment. You were the lead doctor in the emergency room for Lindsay Clancy, right?
I wouldn't say I was the lead. I think the trauma surgeon and I worked together.
Right. Her temperature, her core body temperature was 82 degrees, is that right?
If that's what the record states, then yes.
I'm sorry?
If that's what her medical record states, then
Well,
yes.
as you sit here, you don't know what her core body temperature was?
I saw her 3 years ago. I see about 200 patients a
I'm
month.
sure you're very busy, but this is a murder trial, doctor. Did you review your records and your notes?
I'm happy to look at my record if you bring it here.
Did you review your records and notes before you came in here today to testify on this case?
Sir, I did, but I don't have a photographic memory.
Did she regain consciousness at all while she was in your emergency room?
No.
Can you tell me what CSF is?
Cerebrospinal fluid?
Yeah. Is that what that is?
But it could
CSF?
be. I'm not sure in what context you're referring to it.
Well, how about if there's a massive leakage of CSF from her nose? What does that tell you as a doctor?
It could mean that there's a skull fracture.
Did you notice any clear fluid coming from her nose?
I did not.
Is that something you would look for?
Yes.
How quickly do you get the results of the x-rays when you're in the emergency room?
Well, these were CT scans, but fairly quickly in a trauma.
I'm sorry, CT scans, x-rays. So you had CT scans that were able to show you the damage to her neck and upper chest, is that right?
Yes.
And what did those CT scans show you?
Well, what I remember is a thoracic spine injury.
And when you say a thoracic spine injury, would you agree that top part of your neck, your throat area, would be cervical, right?
Correct.
And that's when the numbers go C1, 2, or whatever they are. That would be the actual vertebrae in the cervical area of the upper body, correct?
Yes, the cervical spine.
Okay. And then below the cervical spine would be the thoracic spine, is that correct?
Correct.
And the thoracic spine would be, and sometimes they're delineated as T1, T2, meaning thoracic 1, thoracic 2, all the way down to what, 5 or 6?
12.
I'm sorry?
12.
12. So when you looked at, and the lower portion would be the lumbar, is that right?
Correct.
Now, when you looked at the CAT scans, did you determine the extent of the injury to the spinal cord?
I could determine the extent of the injury to the bony thoracic spine.
Okay, what was that?
I don't recall exactly the level. I would have to look at the report.
What does that mean, the level of the T?
Correct.
Was her cervical spine injured?
I don't recall. I'd have to look at the report.
Were you aware that her thyroid was crushed?
I don't recall.
Do you know that her cervical spine vertebrae was fractured, destroyed?
I don't recall.
Doesn't that control a person's breathing? Does that have anything to do with breathing?
It can.
What do you remember about looking at the damage to the spinal cord depicted on the CAT scan?
What sticks out most in my mind is her thoracic injury.
Okay, and what was the thoracic injury?
I don't recall the exact level.
What does it mean by effect level?
The exact level.
I'm sorry. Were you aware that there was a complete transection of the spinal cord on T5 and T6?
I'm sure I was aware at the time.
Found his wife in the backyard, bloodied and unable to move. Then systematically went down to the basement and found his children all strangled with athletic bands, knowing that his wife, despite all of that, Patrick Clancy, who is now the ex-husband of Lindsay Clancy, does not believe she should be held criminally responsible. but it's not his decision.
Did you meet with Ms. Clancy on that day, on the 26th?
I did.
When you asked her certain questions, was she able to answer those questions by writing the answers on the paper?
She was.
Okay. And did you ask her about her mood that day?
I did ask her mood.
And what did she write?
She wrote horrified.
And what was her affect during this interaction?
At the time that I saw her, she was intubated, and that in and of itself is very uncomfortable, and so she seemed very anxious.
And did she write anything else on that paper that you saw?
Yes, the entire evaluation was done through writing because she couldn't speak.
So what types of questions were you asking her, and what was she responding with?
So we asked her, you know, how are you feeling? Horrified. And then she wrote down, do I have an attorney? And I said with my team that at this time, we're just getting to know you and getting to know the case, and we're not sure exactly, you know, what is happening. And we asked her, do you have questions for us? And she asked, is my body broken? Are my legs straight? And she then asked about, can she have visitors? And, you know, where her family is.
I know that she was intubated, so she's writing her answers. But based on the answers she wrote on the paper, did she seem to understand the questions you were asking?
Yes.
And her responses, did you understand those?
Yes, she was anxious and she needed breaks, and I said, anytime you need a break, we can leave. But she did write to us those particular answers.
So what she was writing, even when she asked if she had a lawyer, those were things, what she was writing made sense given the situation. She wasn't writing, is there a unicorn in the corner, right?
Correct.
Like that.
What? I'm sorry, I didn't hear that. What?
If there was a unicorn in the corner. So what she's asking, do I have an attorney? Are my legs straight? Is my body broken? Those all made sense given the situation she was in, correct?
They were relevant answers and questions she was asking.
Okay. And are you familiar with the characteristics of psychosis?
Yes.
Okay. And what are the typical signs or symptoms of someone who is in psychosis?
It really depends, and it ranges across a spectrum of symptoms. So we have a whole category of different types of symptoms that we look at for psychosis, and they are different for everyone. But, you know, they can be what we call negative symptoms, which are more internal, isolating, not responding, not reacting very much. And then we have symptoms like positive symptoms, that's what we call them in psychiatry, but they're a little bit more outward focused, where objectively you can see what those symptoms are, like being paranoid, darting your eyes around, responding to internal stimuli, which means you're responding to voices, and, you know, being within a delusion. So there's all kinds of symptoms, and they look different for each and every person.
In your conversation with Ms. Clancy, did you notice any internal or external signs of psychosis?
At the time, I documented that I did not note those.
And did you also note that, you know, she was, her thinking was linear, goal-oriented, thoughtful, and she didn't appear to be responding to internal stimuli?
Yes, that is typical language in psychiatric mental statuses, and I did document that.
What is internal stimuli?
Oftentimes, it's very difficult for our patients to be able to articulate what they're hearing. They may have perceptual disturbances like hallucinations or auditory hallucinations, and maybe hearing voices. When it's really active, we often see those individuals interacting with those voices. I didn't see that in that particular moment.
Would it be fair that some of the obvious signs of psychosis would be someone whose thoughts are disorganized, that their thinking isn't linear, that they're not making sense. Things like word salad, where they're just throwing in words, making sentences that don't make sense.
So you describe symptoms that we can see in people with serious mental illness who have a psychotic disorder with active symptoms.
And you didn't see any of that with Ms. Clancy, is that correct?
Not in that snapshot moment of time.
And to be clear, you only saw her for a limited amount of time on that one day, correct?
That is correct.
And this is January 26th, 2023, about a day and a half or so after she's admitted to Brigham and Women's.
That is correct, yes.
And she's still intubated.
Yes.
And one of the first questions she asks is, do I have a lawyer?
Yes.